Well, if you didn't know, getting COVID-19 doesn't necessarily mean you cannot get it again, especially with the more contagious variants. The Alabama Department of Public Health says there have been more than 4,800 of these reinfections.
Well, Fox 2 News investigative reporter Brendan Kirby joining us now live for a closer look at all this. And Brendan, you talked with a Spanish Fort man who's back in the hospital for a second time because of COVID.
Yeah, that's right, Byron and Lenise. Getting COVID-19 offers some natural immunity, but researchers don't know how long it lasts. And like the COVID vaccines, it's no guarantee against the disease. Billy Culbertson got COVID-19 about a year ago and spent 2 days in the hospital. Last week, he tested positive again. By Monday, his breathing was so labored that he went to the emergency room. He's been at Thomas Hospital ever since. Culbertson, an aspiring actor from Spanish Fort, says he's having too much trouble breathing to talk for extended periods of time, but we had a conversation via text message. He tells me he figured after his last illness that he wouldn't have to worry about COVID. He tells me, quote, "That was basically my exact mentality. I'm healthy. I work out every day. I eat mostly healthy, take vitamins. I figured I had the antibodies and I was in the clear." Not only is Culbertson battling the illness a second time, he says it's worse this time. State and local health leaders say they expect to see more. Mobile County Health Department epidemiologist Dr. Randy Murphy says a COVID infection offers good protection for about 90 days. After that, immunity starts to recede.
Now we have Delta variant. I mean, people could get COVID, 2, 3, 4 times, depending on how this thing plays out.
Dr. Murphy says that researchers are trying to figure out if having COVID previously makes someone less likely to have a severe case the second time. Alabama Assistant State Health Officer Dr. Karen Landers says early experience has been all over the map.
We've actually seen a range in reinfection from not so severe to very severe illness and even death. So this is something that I want to remind people. COVID is a severe and deadly disease.
Culbertson tells me he didn't get a vaccine after his first infection, but after talking with his doctor, he says he intends to get it after he recovers. And if you have gotten COVID, health officials recommend that you still get the vaccine, but they say you should wait at least 90 days if you've had convalescent plasma or monoclonal antibody treatments. Reporting live from the studio, Brendan Kirby, Fox 10 News.